And I remember when the doctor came round and I said, I think she's going to die. And they said, it's one of two things. She's either got a tumour or she's got a inflammatory disease. 6 weeks later, she got her formal diagnosis of juvenile idiopathic arthritis. They told me at one point she'd be wheelchair bound. Yeah. Just before she turned 3, we started methotrexate, the chemotherapy injection that's used to suppress the immune system. So I used to sit there with the doctors and say, what can I do? Nothing. So I made a decision that day. As we got to 6, we got her into clinical remission and we got her off methotrexate, something they told me I would never, ever achieve. Idiopathic means of no known origin. I just don't buy it. There's got to be a root cause.
Jo, so glad to have you here today. Thank you so much for joining us. Now, Jo, you are the head of functional medicine for the Forbes Clinic, and we send all of our most complex cases to you, and including cancer cases, because you have your specialism is in integrative cancer care. You are also the first certified functional medicine practitioner in the UK. So we all go to you with our questions. I mean, all of us are obviously integrative medicine trained within the clinic, but you, in your functional medicine knowledge, hold so much expertise, and you're known for really being able to take that really deep dive into a patient's case history, particularly on that physiological level, but also bringing in those other integrative aspects. So I'm hoping today you're going to be able to tell us all, first of all, what got you into functional medicine?
Okay, thank you. So my functional medicine journey began way before functional medicine was talked about. So I did my undergraduate degree in education and English, thinking originally I wanted to be a teacher, and then realised really quickly I didn't want to be a teacher. So I trained as a behavioural therapist. I went over to Oslo and trained on the applied behavioural analysis programming and supported children with autism. During that early start in my very young age career.
What age was this?
Well, I started training in ABA when I was 17.
Wow, that is young.
Yeah. And then I went to university, did my undergraduate degree, then went over to Oslo and did kind of postgraduate training over there, and started working as a ABA therapist and ABA consultant. Now, back in the day, I had the honour of working with Dr. Andrew Wakefield. I don't think I need to share much more about his name with you. And I got to work with many of the children that Andrew was using as his case studies, where he was finding autism in the guts of these children. Now, what Andrew said, and he worked very closely with a guy out of Sunderland University, Dr. Paul Shattuck. I just don't know if he was a doctor or a scientist, but anyway, very, very wise man. And they used to say that, yes, we found measles, including one of my cases that I was working behaviourally with had never had the MMR. So he'd had measles. But what he did say, and this is where my interest sparked, was, but we know there's more to it. We know there's more to why these children become autistic. But back then, so I'm now talking, 26 years ago, they didn't have the answers. But what I knew was the children that did dietary intervention, gluten-free, casein-free diets predominantly then, did better with their ABA programs than the children that had no dietary intervention. That was really clear. I also got the opportunity to work with the ketogenic diet with a young girl that I was supporting from an ABA point of view that had refractory epilepsy. So she was prescribed the ketogenic diet as part of her epilepsy treatment. And I went on a 5-day symposium in Edinburgh to learn everything there was to learn about the ketogenic diet, of which 4.5 days of the 5-day symposium was dedicated to epilepsy. And half a day, very controversially, talked about ketogenic diet in brain tumours. But at this time, ABA was my kind of passion. I then had my daughter when I was 22, and very quickly, it became apparent that my daughter had chronic health issues. She was 19 months old. I had stopped breastfeeding her 3 weeks before. And having been a really early walker, woke up one day, I put her on the floor out the cot and she crumpled. So I thought, that's strange. I'm going to stand her back up and try it again. And then I did this horrendous thing where I held up a chocolate button and I said, can you walk to the chocolate button? I feel really bad doing that. And she couldn't walk to the chocolate button. So I was like, okay, we've got a problem. No chocolate button's going to entice you. So we went to A&E and it was we were on holiday and they didn't even x-ray her. And they said, oh, she's got a bit of a swollen ankle. I think she's twisted her ankle. And actually there'd been this like tiny little thing in the garden on the slide the day before where she'd got her foot stuck. And I was like, yeah, that makes absolute sense. Why would I question? Why would I question? So anyway, they said, rest for a couple of days and she'll be fine. And we did that. We were on the beach. She didn't want to play. She didn't want to walk around playing. She wanted to play in the sand. And she started walking again 2 days later. I was like, they've nailed it. Absolutely, it's a twisted ankle. So 1 week later after the first event, it was a Sunday. So 1 week later, it was a Sunday again. Exactly the same thing happened. Got her out of bed in the morning, put her on the floor, and she crumpled. I was like, she didn't sprain her ankle twice, 2 consecutive weeks. So I went to A&E. And they said, she's got this swollen ankle, we're going to x-ray it. So they x-rayed it and said it's not broken, but we don't really know what it is. So come back to Forbes Clinic tomorrow. So I arrived the next day with my little bag of, 2 spare nappies and a beaker of water and a snack. And they said it's one of 2 things. She's either got a tumour or she's got a inflammatory disease. And I was like, please, dear God, not a tumour. I can't do that. So they admitted her for 10 days and they did various different blood tests and she had raised inflammatory markers and scans and all sorts of assessments of her. And the working diagnosis was juvenile idiopathic arthritis, but you can't get that diagnosis for 6 weeks. So we had to go with a working diagnosis. So they put her onto medication, just oral anti-inflammatories. And 6 weeks later, she got her formal diagnosis of juvenile idiopathic arthritis. She's about 21 months at this point. So they said, it's okay. How we treat this works amazingly. We'll put steroids in the joints that are affected and we'll keep her on oral anti-inflammatories. She should do all right, but if she doesn't, then we'll use a chemotherapy drug to make her all right. I was like, right, okay, that's what we're agreeing to. This child isn't even 2 at this point. Went to theatre, but it wasn't one joint as they'd originally thought. They examined her. She got 6 joints affected. So they injected all 6 joints. Amazing. She started walking again, only to 6 weeks later, it all worn off. So they took her back to theatre. They injected again. By now we're at 10 joints. 4 weeks later, it all worn off. So when the injections in her joints only lasted 2 weeks, they said, we're on to the next level of treatment. This is not. And already, so she's now maybe 2.5. She's already traumatized. I was pinning her down for blood tests. Already at 2.5, she could say to me, is the doctor going to wear blue pajamas? Which meant her theatre blues because it meant she had to go to surgery. So I used to sit there with the doctors and say, what can I do? Nothing. This is not something you can control the destiny of. So just before she turned 3, we started methotrexate, which, as you know, is a chemotherapy injection that's used to suppress the immune system so it doesn't attack itself. So we had an amazing nurse that came out and taught me how to inject my daughter with methotrexate. Only to within the first 6 weeks, she had bilateral bacterial pneumonia. So she was hospitalised and really quite poorly with bacterial pneumonia, but they treated it successfully with antibiotics. To then 6 weeks later,
because of the methotrexate,
because of the suppression in such a young and vulnerable immune child. I mean, as you know from being a parent, like 2.5-year-olds, 3-year-olds pick up a lot of books, don't they? She wasn't in nursery, but just incidentally pick up a lot of books. So, and then 6 weeks after the bacterial pneumonia, she got fungal pneumonia, which was super hard to treat because they didn't know what they were looking for. And of course, antibiotics don't work for a fungal pneumonia. This took us to the new year, and I was in hospital with her on New Year's Eve, and just as the fireworks went off outside, I was like, I think she's going to die. I think this medication is going to kill her. I don't think the disease is going to kill her, but I think the medication is going to kill her. And I remember when the doctor came round on the 2nd, and I said, I think she's going to die. And he said, well, you know, most children don't die of this medication. I was like, you mean, but some do? And he's like, well, you know, autoimmunity is complex, but hopefully Georgia will respond well to treatment. So I made a decision that day, and I didn't know what I was agreeing to. So she was just turned 3. I was 25, young. And I went, I need to find somebody who can help me. Now, I'd already been using massage therapy, reflexology, and actually it was the reflexologist who said, I know this amazing naturopath in London, take her to see him. And he was American trained naturopath. So I went and I saw him, and he said, okay, her liver enzymes are pretty shot to pieces. Like, her liver is really struggling to cope with this treatment. You have to get her into a different position. We're going to use supplements, and we're going to use diet, and we're going to do an elimination diet, and we're going to. So I left that day with a prescription for 27 supplements. Now, this man didn't have children. So what he didn't share with me, because he had no knowledge, was how do I get 27 supplements, including a greens powder, into a child that, by the way, you've now got to cut out gluten and dairy and eggs and soy and corn and some, like, any foods that she would comfortably eat that I could mix into, you've just taken away from me. And you've given me no insight how I'm going to open these pills up and drop them into food. But you know, by my strength was I was going to turn this around. So I found ways. I remember feeding her for breakfast a Nomato. It's sadly, the brand went off. It was a Nomato sauce that smelt of curry. I mean, my 3-year-old smelled of curry permanently. And I had to put her in a high chair in front of the telly, because the only way I could get this into her was to spoon feed it her as she was gagging. I mean, I felt awful, but I consoled myself that I was going to help. Yeah. So anyway, we worked through this journey, and I was like, but there's got to be a way. There's got to be somebody who can do this journey and understand kids. I was like, it's not this guy. So I started reading all the books. As you know, as a parent, I read every book I could get my hands on, using foods therapeutically. I spent hours in the kitchen. I was juicing. My sole job from the minute I woke up to the minute I went to bed was to syringe 20 mils of fresh organic juice into her on the hour every hour.
Greens juice,
because there was a deal in our house that if it was in a syringe, you couldn't negotiate it. If it was on your plate, you could negotiate it. So my whole existence was making and syringing juice into this child, because I was like, got to get nourishment into her.
Wow.
So whilst trying to heal my child, I decided to train in nutrition. Now, of course, my child decided that every time I had exams, she would get herself admitted to the hospital, and I would have my books up her IV pump, which was to the shock and joy of the nurses. And I was reading initially anatomy and physiology books in the hospital, because every time I was due to have an exam, she was hospitalized with an acute infection. So, as we got to 6 and I graduated from nutrition school, we got her into clinical remission, and we got her off methotrexate, which was amazing and something they told me I would never, ever achieve. So my journey started with nutrition, and actually then I trained in herbal medicine through the Australian College of Phytotherapy. But I got to the end of those 2 courses and I went, I don't understand why. And I'm not okay not understanding why. Like, why did she get sick?
Right.
I then started my nutrition practice, and I was like, but why? Why? That's what Andrew was saying. Why? Why did some children get autism, some didn't? Why? Why did she get arthritis? And actually her rheumatologist said, it's because you stopped breastfeeding her, very flippantly, because she'd developed arthritis 3 weeks after I'd stopped.
Helps with the mum guilt.
Yeah, adds to the mum guilt. It was a beautiful, beautiful part of mum did this. So I started really spreading my eyesight much further apart. Dr. Jeffrey Bland, many of the functional medicine doctors over in America. But functional medicine wasn't a thing. It wasn't
called functional medicine at that
well,
stage. Do you remember?
No, it was kind of loosely labelled functional medicine, but it wasn't a thing. And then I went on my first functional medicine course for 18 months, but it wasn't certified. It was just something you did, but you didn't be anything at the end of it. But it really helped me to go, okay, we've got to find the why. The why was mainly about Georgia, but I then was a clinician and I wanted to be able to answer the why behind the journey of everybody who walked into my office. And then one day in 2010, so Georgia was 8, they announced they were going to certify functional medicine in the world. And I was like, I'm going to be the first in the UK. Not from a position of brain. I was like, but I need to know the answers because then I can answer the whys. So that took me on a journey. And of course, there was nothing in this country. So it took me on a journey to fly back and forth to America.
You did a lot of trips, didn't you?
I did a lot of trips.
With a little kid.
And I said to my daughter, I'm going to go and I'm going to study in America. And she cried and she said, I'm going to miss you, Mum, but I know you've got to do this to help other people.
Bless.
So she gave me her blessing. And I was never gone for longer than, I flew and then came back. And I did... So I started my official training in 2010. And at the same time, I'd always had a real strong pull to supporting people on their cancering journey. People always say to me, why cancer? And most people who specialize in cancer have a big family history of cancer.
Yeah, or some sort of personal journey.
It's not my story. My story was Georgia's, the impact that methotrexate, a chemotherapy drug. So I knew when Georgia was so sick. And I mean, during that 6 years, Georgia was never free of a UTI. Georgia had, I don't know, maybe 20 trips to theatre during that first time to inject her joints, general anaesthesias. She never didn't have a UTI. So she went on to prophylactic antibiotics. She damaged one of her kidneys. She got reduced kidney function and kidney scarring. She had reduced lung capacity because she'd had pneumonia a handful of times. It was rough, and it wasn't the disease, it was the drug. So I found a fellowship in integrative oncology in America. And I was like, should I just study functional medicine or should I do both? So I did 18 trips to America in 23 months.
Oh my goodness.
And I did my training and ran a clinic in the UK.
And Georgia was how old at this?
Georgia was between 8 and 10. But Georgia, when I started the journey, was in remission. And then we lost her remission status. And when she was 10 and prepubescent, her literally went to bed one night and woke up the next day and she had 26 joints fled. So they took her back to theatre, which was a huge trauma to her that this was back. And they said very quickly, you're back on methotrexate. But because of her previous exposure to methotrexate, it didn't work. It worked the first time. So then Georgia had to go up into the disease-modifying drugs and the biologic therapies. But she didn't just get arthritis back. She got psoriasis, and then she was re-diagnosed as psoriatic arthritis. And then when she was 11, she had her first epileptic seizure. And I was like, oh my goodness, I remember everything I learned back in that symposium. And that whole kind of journey of brain inflammation, my body's on fire, that made me so passionate to understand functional medicine at the depth that I understand it. So I certified. How I passed my exams, I still think is a miracle, because I did both my exams in the same week. So I did my 4-hour functional medicine exam in an exam centre in London on the Monday. On the Tuesday, Georgia went back to theatre to have joint injections. On the Wednesday, I flew out to Boston to do my oral exam for my fellowship.
Goodness.
And I got to the end of the week and I was like, I don't know what my name is, let alone, how on earth I've been on this journey. But somehow I passed both my exams and I dual certified almost in the same week in both my functional medicine and my fellowship in integrative oncology. And I learned what I needed to know, which is the why. I was able to train in nutrigenomics, train in genomic imbalance, and find out the blueprint of Georgia and why she got the autoimmune diseases she did. It wasn't because I stopped breastfeeding her. That wasn't the story. The story was she was born with a genomic predisposition to inflammation. She was born a genetic celiac, but we didn't know it, so we introduced her to gluten. And the exposure to gluten triggered an inflammatory response in her body, which initially showed as joint inflammation, didn't initially show as celiac disease. She was diagnosed celiac at 8, but we'd already exposed her to gluten. And why I found out she was celiac was I retrialed an elimination diet, and the minute I took gluten out, her urinary symptoms went away. And her urologist at the time said, well, I don't think that's true. I don't think you've got that right. And I said, well, and he said, but I suppose we should test it for celiac disease, but we need to put her back on gluten. And I said, I'm not prepared to do it for the next period of time. So I kept her off it for 2 years before I followed his advice and re-challenged it. And I think that was part of the kind of re-inflammation that we later got. So my mother journey to fight for my daughter's health, wellness, survivorship is what's made me so passionate about functional medicine, because I don't buy idiopathic. Idiopathic means of no known origin. I just don't buy it. And that's what I kept saying to him, there's got to be a root cause. And the only dietary advice I was given when she started methotrexate was, it's okay because McDonald's has a 5-star safety rating, so you can go to McDonald's, but maybe don't eat in your local Indian because they're often a bit questionable about their safety ratings. And that was the dietary advice I was given through the hospital. And then when she was diagnosed as celiac, it was, okay, these foods are gluten-free, the white Rice Krispies, the white bread, the white, alternatives, no nutritional value for a child that has complete villi atrophy and no ability to absorb any nutrients. I was mind blown by the dietary advice that I've been given on her journey, mind blown. So I was like, I have to self-educate and I have to be that voice to other people. But I also was different to the naturopath that I met with her in that I understand children because I'm a mum. And I've been on this journey with my own daughter.
That journey.
Yeah.
And how much, so you mentioned about the juicing and taking off gluten, some supplements. How much do you feel the functional medicine approach helped her?
That's the microscopic bit of what I've done with her. What else have we done? We've done ketogenic diet. We've done...
Helped her epilepsy.
Yes. We've done a paleo diet. We've done... 100% organic. I cleaned everything in my house I was doing this before the internet. This was back in the day that Google didn't help me. Water purification, air purification. I've used a Rife machine. She's been in hyperbaric oxygen. We've done IV therapy. I've traveled over to America countless times to go and get testing done that wasn't available in the UK. Science. Yeah, back then I couldn't do it here. I flew her out to America every 6 months to test her antibody response to different part tissue in her body. Come home, would do the intervention, the IV therapy, the hyperbaric, or fly her back to America to get more answers. Supplements, that child has taken supplements on a supplements on a supplements. Handfuls, really just to be able to try and put her body back into an element of equilibrium. I've tested every orifice of that child within an inch of its life to find her gut microbiome and her toxic burden and her mycotoxin exposure and her neurotransmitters and her... I've used science every step of the way. And I've, actually had the honor to work with later a couple, 2, amazing NHS doctors. And if you sit with my daughter today and say, which 2 doctors stand out to you? And she's seen hundreds, rheumatologists, neurologists, urologists, orthopedic specialist, gastroenterologist, you name the ologist, that child has been under them all. And there's 2 that stand out. And one is a rheumatologist that has been on her huge medical journey herself. She had bright pink hair, so she was called Pink Pam. So you'll never forget that one. And the second was her neurologist, who, when I said to him, I think she has autoimmune epilepsy, said, I've never seen it, but you're right. And I trust that your daughter, and how we treat this, we've got to work together. And he said, but I know you're right. And I knew I was right because as I was using steroid treatment to help her arthritis, like as prescribed by a rheumatologist, the minute we titrated down on the steroid dose, so when she was on steroids, she had no seizures. Even on 3 anti-epileptics, she was still having seizures. So she was anti-epileptic resistant. So we put steroids for a joint flare. As I weaned them down, I got under 10 milligrams, seizures came back. Then I put them back up because her joints flared. Epilepsy comes.
That's how you figured out it was
That's how I
autoimmune
figured it out.
process. Wow.
But yet when I said it to one doctor, he was like, there isn't such thing as autoimmune epilepsy. I was like, I know this is autoimmune.
Otherwise, why is she? Steroids?
And he listened and he created a mold that he'd never created before. Okay, should we try pulsing steroids? How many days should we do it for? What does that look like? And he was prepared to work with me as her parent, as opposed to come down the authoritative figure, which is what many of her doctors, well, I'm a doctor, so I know best. And I was like, you might be a doctor, but I know my daughter and I live this journey with her.
And it's quite interesting in terms of you're a big advocate of functional medicine. It's your craft, it's your trade, it's what you help people in all the time. But of course, you've had to go through this big pharmaceutical journey with your daughter.
Yeah.
I mean, you've listed all the interventions you've done functionally with her. How can you tell how well they have helped her?
Part of the answer to that question is it doesn't matter what bit has given me the best benefit. I feel that the functional medicine has facilitated the pharmaceutical, but the pharmaceutical has stabilized her to allow me to do the functional medicine. So it isn't a question. It's what I say to people, particularly my patients with a cancer diagnosis. It's not about going, did I help you or did they help you? It's about the end destination. That's what we're trying to get to.
Georgia did better than was expected.
Yeah, I mean, they told me at one point they said she'd be wheelchair bound. I mean, dear goodness me, I at 11, she just started high school when things got really, really out of control. And I was like, I need to pull her out of school because I'd already flexi-schooled her for all of her formative years. I was like, okay, you ready for kind of big private school, full-time school? And very quickly I was like, you're not ready. You can't be in there. And I honestly didn't think. And I mean, this is a child that at 11 was an academic scholar. She passed a grammar school exam in the top 5% of the country. She then started on anti-seizure medication and she was struggling when we were in a shop to take 11 from 20 and figure out how much change she'd got. And she cried and she said, Mum, I can't do it. And she knew her brain was slipping.
That was because of her meds.
It was because of the inflammation from the seizure, but the anti-epileptic meds were, I mean, dear God, it was a mess, a mess.
So she was expected to be wheelchair bound if you hadn't figured out the autoimmune epilepsy.
Well, she'd been on lifelong seizure meds.
Yeah, and having lots of seizures.
Yeah.
And actually, from everything you've told me, it's been
they even at one point talked about brain surgery. You know, he was looking at, well, if I take out this bit, and then he went, actually, you're seizing in both hemispheres, so we can't really do that. Right. But even that conversation was had with her neurologist.
And actually, she's actually gone on to lead an incredibly normal life and has thrived and succeeded against all odds, hasn't she?
She really has.
Fantastically.
She really has.
Is she how old now?
She's 23. She's doing her master's in pediatric immunology. She's currently feeding cancer cells in a laboratory and looking at metastatic cancer cells in pediatric cancers, which was completely her own choice of her journey and nothing to do with me. And I'm not saying she's free of medications. We've got so much of her into control. The difference is she's now not disabled by her life. She's got a big balancing act going in there where we actually managed to access a drug in adult care that we couldn't previously, which has been a wonder drug for her, combined with still doing dietary intervention all the way through university. You know, she was the student who had the slow cooker and the Ocado delivery to Bristol University and the NutriBullet and making her own smoothies at university.
She's really taken responsibility for her health, hasn't she?
She's really
she saw night and day responses if she didn't take care of herself.
Yeah.
So she could easily have been crippled, disabled, fully disabled, and not gone on to be able to achieve the things. But sounds like you've optimized her to the stage where, yes, she has to take some meds, but actually without
and doing
functional medicine
amazing
journey.
yeah, and got her driving license, and which was no mean feast. I was, again, like, amazing to be able to give her that independence. And now she's doing amazing with that functional medicine journey. So I think that passion of her journey makes me want to feel that everybody should be able to access that. And I think that's why I can bring together the passion and the science and the parenting and we can do this together.
You are fantastic with helping kids with their complex conditions. I've seen that many times. And in your work as a functional medicine practitioner now, what sort of results would you say that you get with patients?
It's such a hard question to answer, because most of the people that come to see me, particularly, not just functional medicine, but me as a, years of experience, lots of clinical history, most of those people have already seen multiple conventional doctors, maybe even multiple other practitioners, in the more integrative, holistic mindset, but haven't got the answers that they want. So they might come to the Forbes Clinic and then land on my doorstep. And what I always say is one of my biggest expertise is casting the net really wide. So I look everywhere. I look into all of the labs. I look into all of the genomic patterns. I really want to understand their story. And if I haven't caught what I'm looking for in the first throw, I'll go again. I'm like a dog with a bone. I really like to get to my prize. And what I mean by that is I like to get the answers. So I think that is so important to consider when you're asking what sort of results I'm getting. But what I feel that I, like yourself, am so expert at is really hearing the journey. Because I didn't feel heard in my daughter's journey. I didn't feel that most doctors were prepared to listen. So I asked those kind of questions like, what do you think triggered your breast cancer journey? What do you think happened just before you were diagnosed with an autoimmune disease? What do you think happened before your child got covered from head to toe in eczema? Because that person's been on this journey for X number of years and we're meeting for the first time. So it really is a journey that I make alongside them to gather all that information. Yes, using years of clinical experience and my very scientific, very analytical
Your
brain.
knowledge base is very deep and very high.
But it goes beyond that. It goes much deeper into that, supporting their journey by coming on it with them and then picking it together at whatever level that might look like. And it's when we connect at that level, even in the first consult, before we've ever done anything, they go, I feel hurt. I feel finally as though she gets me. That is invaluable, but that is immeasurable.
Yeah.
And that's why it's so hard to kind of answer that question, because it's like, what are we measuring it on? How much pain you're in? No, because functional medicine and integrative medicine is much bigger than just the single physical symptom that we can say has improved.
And think probably what is measurable is the fact that people book to see you again and again.
Indeed. I think my longest standing client is on something like her 77th consult at the moment. And she just sees it as an investment in her wellness. And how beautiful is that we invest in wellness rather than just focus on illness. So that's something else that we want to keep encouraging, because actually with the state of our National Health Service and the acute medical service that we've got available to us, we should all be putting money into the power of prevention, not just the reactive healthcare system, which is what we've got here in the UK and in most places in the world.
But I know, because obviously I work with you alongside you, I do know that a lot of patients feel, because you work so much with cancer, a lot of the cancer patients do feel that you have bought them a lot of extra time.
Yeah, 100%.
You've significantly optimized their health on their journey with regards to the disease state itself or the medication burden that they're on. And they feel that you are really helping to optimize their function and longevity.
But even that, like if we stick with that cancering journey, so much of that is trying to deal with the emotions. And what a lot of my wonderful, beautiful, beautiful people that I share that journey with have said is how disempowered they feel in the hospital system, how much they feel that their classic oncologist, is rushing them out the door. He's not dealing with the emotional element to them, doesn't ask how they feel. So for the first time, I'm really working on empowerment. That's one of the biggest gifts that you can give to anybody, whether it's on their cancering journey, whether it's on their autoimmune journey, whether it's on their chronic histamine journey, is really empowering them and listening to them and talking them through their story. It just often has never happened for them in the past, sadly, as it didn't for me, for my daughter, which is why I'm so
through
passionate.
it as a parent and for yourself on your own health journey. You've been through it. You know what the complexities are involved in the healing
100%.
journey. But I think there are a lot of natural health practitioners who are very heart-centered people, who are very empathic and fantastic at listening. But I feel that what's so special about what you offer, Jo, is it is that very, very sound, solid, scientific base, that knowledge base that you have, that excellent clinical foundation combined with those other aspects, and putting the two together, I feel is so powerful for people.
I think that comes from 20 years of clinical experience together with a lot of kind of academic reading and academic qualifications, and my years of being a lecturer. You can't stand on the stage and lecture at postgraduate level unless you really know your stuff. I love geeking out in the science, but I like making it understandable. And I like making it things that people can take home, things that people can implement, rather than just reenacting a research paper, for example. But you need both elements to it, because if you don't really understand the mode of action of the drugs, understand the implications of that person's surgery, understand the bigger picture of modern day diseases, understand the burden of the toxic world we live in, understand how all of those antibiotics that you took as a child has caused so much catastrophe to your gut microbiome, and all the things we need to do to put that back into balance. So, I'm very much about, this is not a diagnosis-centered wellness service. This is a individualized journey where science meets human. And I feel that my gift is the integration of, I'm a bit geeky in the research papers, you know that. I'm the first to send you a research paper on something, but I'm able to abstract, and I'm able to apply, and I'm able to humanize, and I'm able to support that whole journey. And I think that's something that is rare, and certainly is rare for conventional medicine.
You were certainly born for this, Jo. So thank you so much for sharing all of that with us today. Really, really grateful. And I know also on behalf of all the patients that you've helped, thank you.
And it to you.